Thank you very much to having me. It's my great pleasure to join here. These are methods of tissue diagnosis for indeterminate biliary stricture. We need several conditions for ideal tissue sampling technique. Contrary to endoluminal biopsy on ERCP, digging with EUS-guided fine needle aspiration and biopsy have several advantages for distal malignant biliary stricture by pancreatic cancer. We are using Proximal needle from Cook for EUS-FNA and B. This case shows distal biliary stricture by pancreatic head mass. ERCP was performed for diagnosis and endoscopic drainage. But transpapillary Forceps biopsy on ERCP was failed for the tissue diagnosis. And then EUS-FNA and B was performed with 25 gauge Proximal needle. Finally, adenocarcinoma was diagnosed on cytology and histology. From our result, the diagnostic accuracy of EUS-FNA and B was 94% with negative for malignancy on transpapillary Forceps biopsy in biliary stricture by pancreatic cancer. However, the usefulness of EUS-FNA-B for perihilar proximal biliary stricture is limited by several reasons, like mainly intrinsic nature, infiltrating lesion than mass-forming lesion, technical difficulty, and risk of needle track seeding. Cholangioscopy provides direct visualization of the biliary tree and improves the ability to characterize strictures. Tissue sampling on direct visualization is a major advantage of POC. The Spyglass system from Boston Scientific provides very useful direct visualization of the biliary tree. This study result by Dr. Dragonov shows Forceps biopsy on Spyglass for indeterminate biliary stricture can significantly improve the diagnostic accuracy comparing with standard Forceps biopsy on ERCP. Now we are having SpyGlass DS. This case shows diffuse stricture with wall thickening on hilum. At first, transpapillary Forceps biopsy on the ERCP was done, but histopathologic result was negative for malignancy. So we performed the POC with SpyGlass DS. You can see diffusely infiltrating mass lesion having typical irregular tortuous vessels on the surface. And Forceps biopsy was done on direct visualization. Now histopathologic results revealed adenocarcinoma. Uday reported high diagnostic accuracy of Forceps biopsy on Spyglass DS for indeterminate biliary strictures. However, still Spyglass DS system has several disadvantages to be a routine clinical practice. Direct POC is direct insertion of ultra-slim endoscope into the biliary tree. Diagnostic procedures with direct POC allows not only endoscopic visual observation by high image quality, but also enhanced endoscopy or effective tissue sampling by large working channel, using bigger forceps for biopsy comparing with SpyBite. Our group reported high diagnostic accuracy of forceps biopsy on direct POC. However, these are several limitations of POC-guided biopsy for distal biliary stricture, like technical difficulty by unstable, sharp-angled tip position of endoscope, and occurred mainly by extrinsic compressed mass lesion, like a pancreatic cancer. ERCP has been the golden standard for obstructive jaundice by biliary stricture, and it's the only option for therapeutic biliary decompression. Before biliary decompression, histopathological diagnosis can be possible by tissue sampling. Tissue sampling during ERCP can be done with forceps biopsy or brush cytology. Brush cytology is universal, simple, and easy method. It can be performed using wire-guided insertion through the stricture. However, diagnostic accuracy of brush cytology using current brush devices was too low. Endobiliary forceps biopsy can be performed under fluoroscopic guidance after sphincterotomy. From our result, diagnostic accuracy of transpapillary forceps biopsy during ERCP was around 75 for the suspected malignant biliary strictures. Especially ERCP-based tissue sampling for malignant biliary stricture from pancreatic cancer is very limited by several reasons, like extrinsic compressed nature, mainly distally located stricture, and desmoplastic reaction. This introductory ultrasound video shows biliary stricture by intrinsic tumor. It means endoluminal biopsy can be easily to get positive result. However, this video revealed biliary stricture by extrinsic compressed tumor from here. It implies a simple endoluminal biopsy can be difficult to get positive result. From our result, diagnostic accuracy of transpapillary forceps biopsy during ERCP was around 57% in suspected malignant biliary stricture by pancreatic cancer. These are limitations of current forceps biopsy during ERCP. So we need a new device beyond current sampling tools. A new cytology brush, Infinity ERCP sampling device from STERIS Endoscopy of USA, has a combination of stiff and soft bristles designed for maximizing tissue acquisition. Each on a 7.5 or 9 French width with greater pushability. Initial result shows increasing number of cell clusters and combined cytology with histology by scratching of hard brushes. In previous study, Infinity ERCP sampling device shows high accuracy for the diagnosis of malignant biliary stricture. Rapid on-site evaluation rows for cytology sample can be possible with Infinity ERCP sampling device for real-time evaluation of sample adequacy and tissue diagnosis. it could make immediate action for therapeutic plan. Very recently, we did a study for the role of Infinity ERCP sampling device with rows for suspected malignant biliary strictures. After brush cytology, transpapillary Forceps biopsy was done in same session of ERCP. The primary outcome was the diagnostic accuracy of ERCP-guided brush cytology with rows. Let me show a couple of cases from our study. For this case, proximal Hyan malignant biliary stricture was suspected. Introductory ultrasound confirmed an intrinsic type of biliary stricture. At first, ERCP-guided brush cytology using Infinity ERCP sampling device was performed. The device was advanced over the guide wire up to stricture segment, and more than 10 times of pro and back movement was done through the stricture. And then transpapillary Forceps biopsy was performed for the stricture. By the on-site cytology with the quick stain, adequate cellularity was confirmed at first brush pass. Malignancy was also diagnosed on rows in this patient. Cytology with Pap staining also showed positive for malignancy. Adenocarcinoma was confirmed by additional cell block histology by Infinity ERCP sampling device. However, only ATPL was observed on Forceps biopsy. Next case showed CBD stricture. Introductory ultrasound confirmed an intrinsic type of biliary stricture. ERCP-guided brush cytology using Infinity ERCP sampling device was performed for this case. And then transpapillary Forceps biopsy was done. By the on-site cytology with the quick stain, adequate cellularity and malignancy was diagnosed on rows in this patient. Cytology with Pap stain revealed positive for malignancy.